The preschool crisis is we don't have enough therapists who understand preschool behavior. In the Black community, our numbers, we are kicked out of preschool 3 times more likely than other children. And why is that significant? It's significant because that's when kids could become connected with school. My own son in 2nd grade was sent home with a letter that if he continued to cry in 2nd grade, if he continued to cry, he would be suspended. I sat down with the principal and I said to her, if he was a white girl in 2nd grade crying because he missed his mom, would she be sent home with a letter? And there was silence.
It's multi-layered, right? So there is a stigma attached to it because it's a lot of negative attitudes and a negative thoughts around people of color who may be experiencing something but don't want to share it.
Beat down for so many years over things. You don't want to have another area where you feel beat down. You don't want to feel less than any more than you already feel less than.
Hi, I'm Dr. Stacy Haynes, CEO, owner of Little Hands Family Services. I've been in clinical practice for 17 years.
My name is Veronica, and I'm a master's level intern.
We are misdiagnosing, we are seeing aggression when it was anxiety. And this is the mental health concern that I have for our children that are not getting the help that they need. They're not getting individuals recognizing that those moments are not about defiance and misbehavior. Those moments are true things like anxiety or fear.
What concerns me about Black mental health services is that there's not enough Black therapists in it to help our children, our community, the urban community. They lack resources. They lack the education about therapy. It's a stigma that, in the Black community with goes on in the house, it stays in the house. We don't talk about it. You don't go outside the house to talk about it to nobody. These are the things that you got to keep in. And these kids is harboring so much stuff that what goes on within their home, and they don't have no one to talk to. They don't have the resources. They don't have the services. The schools don't have the services to give the kids the correct information.
For example, is that we know in the literature, Black boys, Black children will get the diagnosis of more aggressive or anger or bipolar when a white child displaying that same exact behavior, it would be anxiety. But then you go into supervision, and depending on your supervisor and their multicultural awareness will be what that child or what that adult would be diagnosed with. And so a big concern that we have in the Black community is that our diagnoses are typically based on more what we call aggressive behaviors or aggressive symptoms, and we're seen more aggressive by non-Black therapists and clinicians.
The Black mental health crisis has gotten worse. You see the trauma before it happens, but people ignore the trauma. They ignore the signs. Because you get warning signs, you see the signs, you see something ain't right about somebody. You see it. But people ignore it, or they're going to be all right. This crisis right here that we're going through, the killings, our people need help.
My name is Denisha, and I am a licensed professional counselor.
Hi, my name is John Gaines, and I'm the senior pastor at Cultural Life Church in Blackwood, New Jersey.
It's multi-layered, right? So there is a stigma attached to it because it's a lot of negative attitudes and a negative thoughts around people of color who may be experiencing something but don't want to share it. They may be labeled, like you said, as crazy, but they are suffering in silence. There's also another layer part of it in terms of like provider bias and just mistrust of the healthcare field in African American and Black communities. We're not always treated the best when we seek out treatment and need help. We get turned away, and that creates a mistrust in that. So it's like, well, why would I want to go and see someone and talk to them about it? They're just going to label me, or they're going to discriminate against me or stereotype. So I don't want to share that, and I don't want to like be looked at or labeled as crazy.
I think nobody want to end up in the crazy house, to use bad terms. I think that the terms that are surrounding our mental health are scary. And when we hear those terms, nobody wants to be labeled those things. So I've heard, again, recently I've learned some things about mental health that they're changing the way things are labeled. And I think they're a lot less threatening. And I think that may help. That's going to help people feel more comfortable going, specifically Black people, because we've been beat down for so many years over things. You don't want to have another area where you feel beat down. You don't want to feel less than any more than you already feel less than.
Also, there is a big faith and spirituality component. It feels like, well, I don't need a therapist. I have my faith, whether that's Christianity, Islam, Buddhism, whatever that is. They're like, I don't need it. But it doesn't mean that just because you have your faith doesn't necessarily mean you don't need mental health care.
The Black mental health crisis is centered around poor education. Just not understanding that, hey, we can get help. And I even think that some of the things that we experience in the Black community, and I wouldn't just say Black community, but a lot of communities, the cultural things that we look at that we call cultural norms are dysfunctional. And they've come from generations of dysfunction. And hey, my grandmother did it like this, her grandmother did it like this, so I'm going to do it. Well, no. I'll give you a prime example. I was taught as a child to put butter on a burn. That doesn't make any sense. If you put butter on a hot pan, it's going to fry. So you had to relearn something. So I think education is key when it comes to mental health, to understand that, hey, certain behaviors are not good. They're not normal. And so that's where I think that will help. Education will be a huge help for the Black community when it comes to mental health.
One of the things, even the idea of going back for my doctorate degree, was about if someone's seeing me and they see a master's level Black therapist, a master's level white therapist, are they going to come to me or are they going to go to that person? Many of our struggles as business owners come back to the fact that we're a Black therapist. When you think about it, do you pick your doctor based on race, gender? Many of us do. Again, we're not racist. Let's be aware of our own biases and our unconscious bias, but many of us do. And so if I'm going to entrust a provider with my child, my most precious thing, oftentimes I'm going to want that person that looks just like me.
Showing up and proving to others that you belong in the space of mental health profession. It is a field, I believe, that's dominated by white males and females just in our society as a whole. If we look at just this area in South Jersey alone, it's really not that many minority business owners in the field. There's more so, like if you look up like Psychology Today or American Counseling online, it's a lot, doesn't have a lot of our Black and brown faces on there. So I feel like that's probably one of the biggest challenges of just trying to get business in the field of being a Black therapist.
The barriers is me being a single parent and trying to work, take care of my children. My parents had some health issues. I had to help take care of them back and forth. And that was a little hard on me because they live in Philadelphia. I live over here, going to school, internship, but I knew I couldn't stop but I couldn't stop helping my parents neither because they needed me. And that was the major barrier for me.
So hi, my name is Mimi Ryans. I'm a clinical social worker, licensed in Maryland, DC, Florida, and Georgia. So I have been a clinician since I graduated, I guess, grad school in 2006. I think it was 2006. I have been in private practice since January 4th, 2009. It's been 9 years. I can't do the math. 14, that's what it was. It was 1414. So started private practice January 2014. I've had a private group practice. It was my primary source of life for probably 7 of those 9 years. Last year, things changed a little bit for me, but yeah, my practice has been, and we're an insurance-based private group practice. So so not only do we get well, you must not be as good because you take insurance, right? But then you get well, you must not be as good because, well, you look like this. So I noticed, so from the time I started my practice until now, what I did notice is a shift in people of color's desire for clinicians, right? So I used to have moms would call, or dads, but mostly moms call for their children to get therapy, just my thing, and would say, "Do you have anybody that looks like you?" Like if I said, I'm full, like I have no capacity, but I've got the clinicians. Well, do they look like you? Like, is it okay if I ask if they're African American? Like, and so that was a really cool shift to watch. However, there aren't a lot of us. In fact, there are very few of us. So we fill up, pretty quickly. This country has stigmatized people of color of being less than, right? So we've always had to work a little bit harder, do a little bit more, be a little bit, more in order to be, I feel like, taken seriously amongst our peers.
Because they don't think that we can do the same job as them. As I said in the first statement, they just think that we're not educated enough. We don't get enough education. We don't go to the right schools to get the proper education. We're not going to the right facilities to get the proper education. And a lot of us are not going to the right schools or not going to the right facilities. But I picked the best facility to get my internship. Dr. Stacy is awesome. I done learned so much from her. Her skills, amazing. Amazing. And, and she's rubbing off on me because, I go see my clients and I be like, oh, this is wrong with you now. Oh, this is wrong with you. And then my colleagues look at me like, well, how does she know that? Had the best intern supervisor ever.
In the 17 years I've been in practice, I've had maybe 20 interns at the master's level. 3 have been Black. The experience of a Black intern is so different than a non-Black intern. One of the things, most recent, she came to me and she was doing her interview for her internship while she was at a funeral, literally in the parking lot, because she knew how important it was, but also it just speaks volumes to her experience. And there have been times when she's cried in my office because of things going on with her family, just emergencies. And it's not that they're not real, but it's a part of her story. Many Black therapists, when we look at entering the field, we don't enter until later in life. And so you look at the span of, a therapist that, let's say, started right out of college, master's degree, graduate school in their 20s. Most Black therapists are starting their careers in their 40s.
Why are Black therapists starting their careers later?
A big concern with graduate school is the cost. And many of us, unfortunately, don't realize we educate our children on first 4 years of college, right? You pick a major, you get a degree. But to recognize that, let's say I want to be a counselor, a therapist. Well, you're talking 2 to 3 more years of graduate school, and oftentimes there's no funding for that. So now it's a matter of, do I take out loans? Do I work a job? How do I pay for graduate school to support, again, even at that point, I'm a young adult, to support myself and to go to graduate school. Many people have to make the choice and they decide to go work a job, then come back in the field later on when maybe they have the finances. Or even I've had a lot of, currently like my intern now, it was never something she thought about until having her own special needs child. And now she's coming back in her 40s to be able to go to school. No, she's in her 50s. Sorry. In her 50s to be able to go to school, take care of her child, work a full-time job, and do an internship.
around 27, 28 years old, I became a licensed professional counselor. Overall, around 85 to about $100,000 from my undergrad, getting 4-year degree, then a 2-year degree in graduate school. Then post that, I had training, internship hours, and license, getting my license, paying for that, also CEUs and all that. So with inclusive was $85,000. As a Black woman in graduate school, I went to Chestnut Hill College, and I was one of few in all of my classes and courses. Not many Black males, not that many Black women, and I felt like in those classes wasn't so much difficulty, but a little bit uncomfortable in the sense of just trying to get my perspective, my experience that I have to the table, to the profession. And I didn't have that many professors of color either. I could remember having maybe 1 or 2 professors, one as a Black male and then one Hispanic female, and one during my training. Investing in the field of being a professional counselor or even a psychologist or a psychiatrist in the field. There's a lot of money, there's a lot of time as well as training that requires to be a mental health professional in this field. And I believe that is a barrier that prevents a lot of people from entering it because you don't get as much as return as you would if you were maybe a lawyer, doctor, or any other profession that you may see, or nurse, that type of field. If you're not in it, I feel like if you're not in it for that, then it probably wouldn't be a good suit for you if you feel like you need to just get into the profession just to make money, but this is probably not the field for you if that's your driving force.
If we look at different studies, we'll say maybe 6 to 10% of practicing mental health professionals are Black. If you ask me, I think that number in reality is a lot less. I can tell you in maybe a 50-mile radius of practice, a handful of Black therapists. I can tell you maybe 2 Black male therapists that I've come across even in our local area.
You know, in my ideal world, I would love to see more people who look like me training, providing the opportunity. There's the same people, and if they're not the same names, they are older, white, younger, white, female. I don't know why we're not training. I think that's one of the, and I do think that's one of the things we need as clinicians. Like, we need to see us presenting the information to us, right? Because I'm having a hard time buying into a lot of it. Like, I hear the same, all these CEUs I have to get, like, I hear the same things over and over and over and over again. It's like, come on, can we have we need some new perspective. But that's a big thing for me. And I do think we need, I think we need clinicians to be more mentoring. I specifically work with the University of Maryland School of Social Work, and predominantly not people of color, to introduce them to the world that, you know, that they're going to be working in. You know, it's like, you're gonna have to have a little bit of diversity, and it's not a savior mentality. It's like, I'm gonna go into the inner city and save these little Black kids. It's like, no, we don't need you to save our kids. We just need you to acknowledge that this is where they are. This is who they are, like you would do with any other kid.
Without any hardcore evidence, I can look at certain things like a large majority of Black men that even enter college enter in business degrees. They're not even going for the science degrees, such as physicians, lawyers. So to think of a mental health therapist, that's probably so low on the totem pole that they wouldn't even consider even looking at that. So in thinking about that, imagine if people began to have a different outlook on mental health therapy. Now, listen, finances is always going to be an issue. You know, people are always going to say, hey, I'll go through all this schooling, but I'm not going to make enough money to pay for the schooling that I had to go through. And that's in a lot of fields. But I think mental health is such in its infancy that it just has not reached our communities yet. And we don't feel comfortable even talking about mental health. You know, so many of our parents dealt with poor mental health, or maybe even our parents' parents coming out of some of the traumatic events such as depression, the Great Depression. How did that affect my grandparents? Because they lived in it. So then how did that affect my parents? Because they grew up with parents that were affected by the Great Depression. So now I'm that next child. So now we have these 3 generations of trauma, and now I have a child. So if we can begin to change the stigmata that wraps around mental health, and people can understand, hey, you know what? Maybe if I get some help, maybe this is a field that I want to get involved in.
Most businesses go out of business within the first few years. Most therapy practices go out of business the first 5 years. It takes a lot to learn how to run your own business, and many of us in graduate school, it's not a course that we had, it's not something that we learn. But also there's a trust about Black businesses and being able to trust business owners that are Black. Tell me what life is like now post-COVID and what COVID did to your practice.
February 1st, 2022, so a little over a year ago, I closed my doors permanently. I no longer have an office space. So we went from 2 offices, about 15 therapy rooms, 2 playrooms, a santry room, to everybody is working remotely and trying to figure it out. As a result of closing my practice and downsizing, and going from 2018, and I'll just say 2018 to 19, 20, 21, right? These last 3 years post-pandemic, I have lost about $500,000, so about $500,000 in revenue, not in income, not my personal income. It'd be nice, but revenue in my practice. At one point, we've stopped working with some of the insurance companies because post-pandemic, or I guess right in the throes of the pandemic, they were just not paying claims, and I was paying people. So you can't not pay your folks because your insurance company didn't pay you. I just think that's grimy. So with that, right, came some significant losses, which is one of the reasons I did downsize and actually close the physical space, because we just couldn't afford it. Like the rent that we were paying, it was just too much. But yeah, I can honestly say in revenue, we've probably lost about $500,000 over the last couple of years.
What do you think would help the Black mental health crisis?
One of the things that I believe that would help the Black mental health crisis is just diagnosing, getting an accurate diagnosis of people of color, not just children and adolescents, but also adults.
They need help. They need to be educated more. They need the right resources. I hear people talking about the, love and peace and all that. We need to go out here and march. But then where it starts from home. And if we don't start knocking on them doors, going into the houses and seeing what's going on at home, we ain't gonna never get to these children. It starts at home. I tell anybody that. That's the only way we're gonna get them, because we gotta see what's going on in the homes first.
So the minute you know that there was trauma, the minute you see certain behaviors that you would have to look at as being unhealthy, and that takes some onus on us as spiritual leaders. We have to understand a little bit about what depression looks like, what poor mental health looks like. We have to understand that a little bit, and then we have to not look at it as though I can fix everything, because you can't. And unfortunately, as spiritual leaders, we can kind of end up with that feeling, that godlike complex. But we have to understand that we have to turn those over to the Lord, just as we turned our lives over to the Lord.
And we need clinicians who are going to come and do the work and do good work with these families and these kids who are going to, post-pandemic, are going to need such a different offering than we've even offered up to this point, right? So that's my advice. Do it. Do it. Both hands and both feet. Jump right on in. Come on. Because I mean, it's so much fun. It's fun work, but it is work, one. And make sure that you practice your own self-care, right? So get a good therapist. Get a good therapist. Make sure that you take care of yourself physically, emotionally. The things that we tell our clients and their parents. Those are the things you need to make sure that you're practicing prior to starting this, because it's going to be a roller coaster ride.
I know that people are looking for a Black therapist. They're looking for Dr. Stacy, and they want to see that I'm out here. And I think more of us need to say, hey, we're here, and how do you access us? Right now, even to get into most therapists, you're talking 8 to 9 months, if not a year wait. And so we really have to, again, meet this need in the community by saying, I'm willing to work with children. I'm willing to open my doors late at night so a mom that's working till 5 or 6 in the evening can still get to an appointment for her child. We need clinicians that are willing to work on a Saturday morning like doctors do, so that families can feel supported. And we need to have more therapists that look like me.